Hello, it's Dave with Utah Physical Therapy and Kelly. We are going to talk about ASTYM today. ASTYM is a treatment that we use a lot in the clinic, and I thought I'd demonstrate it while I talk about what ASTYM does and the reason why we use it. So Kelly has volunteered a week before her wedding to get ASTYM. Hopefully she doesn't bruise, but we'll find out. It will be interesting. So put your foot right up here, Kelly. So ASTYM is a way that we can stimulate healing in tissues that are chronically injured, like tendinitis, plantar fasciitis, tennis elbow, all those chronic issues that just don't seem to go away, that have been there for a while and hurt, but they're not healing. So one thing we need to think about initially is inflammation. Inflammation isn't really our enemy. Inflammation is the way that our body heals. And a lot of times in chronic injuries, we get pain because the tissue is weak, but there's no inflammation to finish the healing process. So with ASTYM, what we're doing is we're trying to stimulate the body's own healing response to finish healing the tissue. So I use the 3 different tools to do ASTYM, depending on the size of the area that I'm treating and the muscle tissue. So I put pretty good pressure, and Kelly hasn't actually had ASTYM before, so we'll have to see how she does with it. We may have to mute it in a little while, but so basically what we're doing is we're stimulating the tissue, we're increasing activity of cells called fibroblasts and macrophages, increasing growth factors, trying to stimulate the body's healing response, and then we'll guide it with exercise and with stretching. So typically, a typical course of physical therapy with ASTYM is usually between 6 to 9 times, and we usually see them twice a week with a couple of days in between treatment. And then we give specific exercises after and between those visits, so the person can work on strengthening and guiding the healing process on their own. So with Kelly, this area that I'm working here, she doesn't really have a problem, but I want her to experience what our patients experience. But for the leg, some of the problems that we see are plantar fasciitis. We also see tendinitis, like Achilles tendinitis. Shin splints are a big one that we see in this area of the body, and we see tendinitis of different tendons around the ankle. So those are some of the things that we use this for. I'll also use it for calf tightness, and a couple of years ago when I was doing support for the Ragnar Wasatch back, we would use ASTYM as a way to loosen up people's calves. A lot of times they'd have a lot of pain in their calf and a lot of tightness because they're running up and down hills. So there are a lot of different things that we can use it for in the leg, and even more in the arms, and I use this on the back and neck as well. It's usually a little more sensitive in the legs and arms though. So Kelly, how's it feeling?
Feels fine.
I must not be pushing hard enough.
I mean, it really hurts.
It really hurts. So you'll notice on her skin, I don't know if you can see, but it's starting to get red. And that redness is just blood flow increasing to the tissue. And that's a good sign. About 10 to 15% of people that I treat with ASTYM will bruise. So we'll have to see if that's the case. I doubt Kelly will bruise that much. So we just work all through the tissue on different attachments of the muscles, doing pressure to stimulate that healing. Okay, so we'll stop there on the front side of the leg. And I'm going to have Kelly lay on her stomach with her foot just off of the end of the table. One way to think about ASTYM is we're trying to take the tissue and make it into good collagen tissue. Collagen is what our muscles and tendons and ligaments are all made up of. And normally, like Kelly's Achilles tendon right here, most of those fibers are all lined up in one direction. So with let's say she had Achilles tendinitis. With Achilles tendinitis, you get those collagen fibers, kind of like scar tissue. They're just disorganized. The analogy that I like to use is it's like cooked spaghetti in the bowl. It's all kind of disorganized in that area. So what we're trying to do, we're trying to stimulate the body to reorganize it into those nice lines where it's normal tissue. So that disorganized tissue isn't able to take the load that we normally put on the tissue, and that's why it's painful. So we want to stimulate that healing process. How we doing, Kelly?
We're doing okay.
Yeah? It's a little more sore on this side, I bet.
Yeah.
So we'll just work through the calf. And I'm stimulating this along the lines that I want that collagen to remodel. I want it to straighten out. I want the body to lay down new collagen tissue along the lines of stress, along the lines that it's going to be pulling. So we work on the larger muscle groups, the larger muscles, getting where the knots are in those muscles, working our way down to the Achilles tendon. How we doing there, Kelly?
That feels really good.
Feels awesome. Kelly's a fan of yoga, so she knows what pain's like, so she doesn't even flinch. So we work right along that Achilles tendon. And it might seem like this would be kind of a feel-good massage, but these tools aren't the dullest. They do have some sharpness to them. And I am putting pretty good pressure in this. So ASTYM normally isn't pain-free. It's kind of uncomfortable.